Hello, everybody. I'm Riley. I will further introduce myself at the a little later regarding specifics, but I'm going to be talking about disability services and disability accommodations in the realm of college and university. But first, let's get to know some other people that we'll be chatting with. Oh, maybe I get to play the fun game of will my computer work with us? So, alongside myself, we're going to have a couple individuals from the IBD and Celiac Clinic. Really sorry, guys, if I said that in the wrong order. So, we're going to have Farah, who's our registered dietitian at the clinic, Dr. Ren Anava, unsure which way you want to go by, but we'll call you both. Our child psychologist, is that a good way? Yeah, okay. I'm really sorry. Um, Dr. Jericho and Dr. Benson will also be here to talk about kind of the more specifics along the lines of IBD care and celiac care while you're away. But first, we're going to kind of chat about some actual people that experience this in college. So Yuvraj is going to talk about celiacs. So you want to come online and chat a little bit?
Yes, thank you, Riley, for the introduction. Hi, everyone. My name is Yuvraj. I'm a first year at UCLA. I'm concentrating in biology on the pre-med track. So if you have any questions about that or about celiac, feel free to ask. I know everyone's journey to diagnosis is a bit different. Personally, I had no symptoms my whole life. I still don't actually, except for my iron deficiency. So I was shuffled from hospital to hospital in an attempt to figure out what was wrong. Ultimately, I was diagnosed with celiac about 4 years ago. So that's kind of where I am right now.
Thank you so much. All right. And Mia?
Hi, my name is Mia Hawkins. I was diagnosed with celiac when I was 9 years old. I'm currently a college student at the University of Nevada, Reno. I'm about to graduate in like a month. Uh, I am a creative writing major, if you're interested. I also didn't have symptoms growing up, but my brother did. And when he was diagnosed, I was then tested and then diagnosed.
I'm so glad you guys are here. All right. And up next is going to be Shira.
Hi, my name is Shira Futornik. I am currently a junior at Bates College, which is a small liberal arts school in Maine. I'm studying neuroscience, and I was diagnosed with ulcerative colitis when I was 14, my freshman year of high school. And so I've been through like a bunch of different things with it, but I've also learned how to navigate being far away from home with my UC. And kind of managing it all on my own. So that's been interesting. Yeah.
Thank you so much, Shira. And not a college student anymore, but it sounds like going to hopefully be another college student soon. Zach?
Riley, Zach, are you there? I
Oh
think there
no.
were some technical issues.
Yeah,
Yeah,
I think his connection wasn't working well, so
Darn.
he's joining, but we can introduce him. Zachary is a recent grad, just graduated this
oh
spring.
no, I think you're back.
Is he here?
Sorry.
He's back.
Sorry, I tried to do the cool background thing like all you guys, and it broke my computer.
Oh no. Well,
Uh,
welcome back, Zach, and pass it to you. You can introduce yourself.
okay. Hi, my name is Zach. I am just a recent graduate at Colorado State University. I majored in biology and minored in chemistry. My dream, I was diagnosed with Crohn's disease when I was 15, and I had awesome GIs to help me through all the way. So my dream is to become a GI because of that. Like I said, I was diagnosed with Crohn's at 15. I've also had a fistula and an abscess before. Uh, Going through college, I used all my accommodations when I could. I don't know how much they talked about it already, but uh, with accommodations, just keep in mind that your teacher doesn't know your specific accommodations, you do. So kind of take control of that. And then another piece of advice for going to college is if you get infusions regularly, it's not your parents' job anymore to schedule it with the pharmacy or with your nurse. It kind of is now your job, so you have to kind of keep up with that and take care of it.
Well said, Zach. I love that. Yeah. Um, well, so later on, we're gonna have our patients come back and kind of give a little more one-on-one and answer some questions that anybody here might have regarding like celiac or Crohn's, ulcerative colitis, indeterminate colitis, everything and nothing under the sun. So if you guys want to save your questions for the end, I know they would be willing to give their own personal perspective later on. Um, so I'm Riley. The reason why I kind of do this and lead this every year is because I also have IBD. I have Crohn's disease. I've had it since I was 8 years old. It's not a competition, but I think I've beat everybody on the little patient slide at least. At least that's always a joke of who can be the youngest patient at Camp Oasis if you ever go. So I have Crohn's disease. I've had an ostomy since 2015. So I just celebrated 10 years of having an ostomy. My permanent ostomy, which you can see in that photo with my best friend Allison. Her name is Marigold, my ostomy. So that's kind of, this is a special subject to my heart because I get to support students like you guys, as well as this is my wheelhouse. This is what I do for a job. So it's kind of fun. So specifically, what is disability services? This is my domain. Disability Resource Centers is often kind of the common name that you're going to find at your university. It might look different. That's how I pulled up some photos from other universities across the country. My alma mater, University of Missouri, which is this lovely photo behind me. You can see that it's Disability Center. University of Florida, straight up Disability Resource Center. Stanford, where I work, we're kind of an oddball. The Office of Accessible Education. All of these do the same thing. They work under the same frameworks, same legal compliance, everything. It's just going to be a different name. If you ever have a problem about finding your Disability Resource Center, just type in disability and then your university. No matter what, you're going to find their website. So, kind of getting into the groove of like, how do you get services? Well, the first and foremost, first thing is you have to have a disability. And I know that word can seem a little icky, can seem a little, I don't relate with that word. And that is totally fine. You don't have to relate with the word disability. Just know IBD and celiac disease qualify as a disability. So the only time that you actually have to say, I'm disabled, is when you come to my office. Other than that, you never have to identify with that word. Actually, whenever you leave my office, the only way that you know or another person knows is a letter. And even that letter isn't going to say, Riley Murray has Crohn's disease. It's just going to say, Riley is registered with the OAE, Office of Accessible Education. Here's her accommodations, implement them. That's it. So, though, to get to disability resource centers or to get even accommodations, we have to go through a couple hoops, one of which is going to be documentation. The really good part is the clinic you work with already has fantabulous, wonderful documentation. So you just need to work with your medical care provider to get that going. I normally would say work with the social worker, but I think the clinic is working that out. So please make sure you just work with maybe even Farah, Dr. Wren, Dr. Jericho, Dr. Benson, whoever is under your care. They should be able to navigate that process with you. So I like to kind of show our guidelines at my office. This is taken from the really big umbrella organization that oversees like a lot of disability resource centers on campus. So if for some reason you have another condition that maybe is not overseen by this clinic, you can take this summary, give it to that provider, and they should be able to write documentation that meets your university's guidelines. And normally this would fit that. Now, please know it's probably going to differ from institution to institution. So please make sure you touch base with your institution before you kind of ask for documentation. One, because sometimes it can cost you money. And two, I don't want to utilize your provider's time when you might have to come back and get something that's totally different. So again, all of these slides, and this is going to be recorded. I only say that because if anybody's like, oh, this is really good content to remember for like a future meeting, good part is you can come back to it. You're also welcome to take a screenshot. I'm totally okay with that. So some academic accommodations that will maybe potentially be approved kind of depends on frequency, severity, duration, in which your student experiences their condition. So let's say a student is experiencing a really bad Crohn's flare, and I only talk about Crohn's because I have Crohn's, so I can kind of take that from experience. You might get additional excused absences, whereas maybe you've only flared once. You might not get a lot of excused absences. It's all about how you experience it, and that's going to differ from patient to patient. So some accommodations you might have exactly within the academic setting is going to be like preferential seating, breaks during class, access to food and water, additional time on your exams, everything to kind of accommodate maybe going to the bathroom, inability to get to class due to like really bad stomach cramping, needing to go to an infusion or a doctor's appointment. There's like things like this we can accommodate. Now, my favorite, because you might not think about it, because academics is usually the thing we think about in school, but now you're going away. So we have to think about your housing, because normally at your house, you can kind of navigate this on your own. You know where your bathroom is. You know who's going to be next door to you. You know that you're not going to have, I don't know, somebody else in the same room as you. Well, now in college, that's kind of inherently the thing. You're going to have a roommate. You might share a bathroom with 40 other people. So, how are we going to navigate that urgency, that duration of staying in the bathroom? Maybe frequency as well. These are all things we kind of have to think about whenever it comes down to where are we living on campus. So, things that we could accommodate would be like the fatigue you might experience. So, let's say you're just having a really bad fatigue day, or you're frequently having them, or Remicade infusions are like kind of making you really tired afterwards. And you can't really yeet yourself up 5 feet in the air into your lofted bed. So, we're going to have to bring that down a little lower. Now, it can be a little difficult to do that by yourself. At least for me, I don't know how to de-loft a bed. Absolutely not. So that would be nice to have maintenance de-loft it for you. Other things you can think of, kind of bathroom access, private bathroom. That sounds really nice. Maybe single occupancy, or maybe actually, I just need many options all at once. And that can be fantastic. And then another thing I always like to think about is proximity to classes. That might not seem that big of an issue, but I tell you, when you switch a med, go through a really stressful time, such as like finals, or I don't know, just life in general, being super far away from your classes at 8 a.m. in the morning when you've been on the toilet all morning, it's not a great time. So being closer to those classes so you can accommodate that time can be very beneficial. As well as close to a dining hall, depending on how your fatigue is doing, or maybe some other conditions. Like I know a lot of the times IBD, celiac can come with some feeding disorders. If that's the case and you need to be closer to help promote eating, that's something else we can do. Another one that can be very much dependent on the university you're attending is going to be kitchen access and meal plans. So please make sure that you're meeting with like FARA to make sure that you are accessing nutrition in a healthy and proper way. But then on top of that, most universities around the country are gonna have FARA equivalent on campus to assist you in knowing what dining hall has what food, how to make sure you're not going to have an allergic reaction, or you know what is exactly in that food. Or, as I like to call it, the secret menus. Sometimes you might have access to that because you qualify for disability accommodation services. So you might get a plate that is specifically cooked in one pan and only touches one other person's hands. Whereas, let's say if it's just the buffet style, you don't know who has touched it, what has touched it, etc. So it's having a little more authority over what and how it is made. And of course, at any point, if you have any questions about this, I highly recommend working with your university, almost starting now, because they can start answering a lot of your questions, especially if you're starting next year. So one thing that Zach kind of mentioned was infusions. So if you are taking a specialty medication, if you have durable medical equipment, so think about like ostomy supplies, think about diabetes strips, anything like this. Or if you just need to pick up your Xeljanz, your Entyvio, you can't pick up Remicade, all these other ones, Humira, etc. Where's it going to go? How are you going to get it? Where's it going to be stored? These are all things you kind of have to think about. Thankfully, my university I attended, as well as Stanford, they have really big retail pharmacies on campus. So for example, Stanford has Walgreens. So all students can ship their specialty medication to that Walgreens. That pharmacist then sticks it in a fridge, if it's like Humira, for example, and make sure that it's temperature controlled. Then when you're ready and you're available, you can go pick it up at the Walgreens, take it back to your apartment or your dorm, stick it in the fridge, or take it however it works. But these are like kind of the specifics that you kind of have to think about. Where's it going to go? Who's going to pick it up? Does it need a signature? That's really big and important. What are you going to do if it breaks? All of these logistic questions you might not have thought about previously because mom, dad, special person just picks it up or it gets delivered. What are we going to do now? Another one is going to be infusions. Where are you going to go for an infusion? How are you going to get there? How are you going to take care of yourself afterwards? These are all important questions and kind of situations to think about now before you leave. And maybe also kind of like do a walkthrough. See what it's like going from your dorm to the hospital you're going to get your infusion in. Take public transit, drive your car there, see where you're going to park. Kind of do all of the first day jitters. That way you can get it out. Another thing that you might not want to think about, and I totally understand, and as a person that has had to do it, please make sure that you think about it, is what are you going to do in emergency situations? IBD, I'm sorry, I don't know much about celiac, so I do apologize, everyone. IBD, at least I know of, you can go to the ER kind of at any moment, depending on how your condition is impacting you. What are you going to do in those moments? Who's going to go with you? How are you going to make sure everything goes with you? How are you going to take care of classes? These are things we don't want to think about because nobody wants to go to the ER. The ER is my trauma place. I kind of just disassociate and black out. But these are things we have to think about in the moment, especially now that you're going to be 18, hopefully soon. And mom and dad, special person, might not be with you during this. So these are kind of the things that you need to think about. This is the one time I'm going to say, mom, dad, guardian, special person, you have full right and autonomy to kind of plan this with them. Otherwise, everything else has to be on your student. They can do it. I know they can. You can help them, but they have to lead the discussion, and they can do it no matter what. All right, Farah, time to shine. Take it away.
Thanks, Riley. It's always so cool hearing all the different topics you talk about with your students. So thank you for sharing. Well, for those who join later, my name is Farah. I am the center's dietitian, and I specialize in celiac and IBD. And obviously, I'll be talking about nutrition. But before we start talking about it, I just want to say a big congratulations to everybody who's entering college. It is so exciting. It's a new chapter. And just from talking to different patients who went through this transition and doing this webinar in the past, I know that there may be some questions about like nourishing your body in a new environment. And everyone eats, right? So this topic is relevant to everyone, but it's especially pertinent to students who are following a specific diet for medical reasons, like the gluten-free diet for celiac or diet therapies for IBD, or even, those who have allergies or different preferences. So that's one of the reasons we have this webinar. And to help with the transition, I just added some tips and tricks that helped my patients before, and I hope that they help you too. So first and foremost, it can be really helpful to explore and learn the options that are specific to your college. And Riley already talked about this, so I will just reiterate really quickly. When it comes to meal plans, just because a meal plan is offered at the college, it does not mean that it is the best or the only option for everyone. So some people find that eating all of these meals at the dining hall is the best and most convenient option, which is great. But for those who think that these options would not meet their needs or preferences, some colleges will offer exemptions or even like partial plans or reduced swipes to give students an opportunity to eat meals elsewhere. It can also be a good conversation to have when you're talking about accommodations, just to learn more about kitchen access, like Riley mentioned. If you have multiple dietary restrictions and you enjoy cooking or you want to learn how to cook, it can be helpful to learn about the options. Like you might have a kitchenette or a full kitchen if you're lucky in your unit, or maybe a communal kitchen on the same floor. But I know that cooking can be time consuming, especially for a new college student. So it's just to mention to you that it's an option that can allow for more flexibility if you need it, or some ease of mind for some people. So just make sure to learn about the different options and accommodations at your specific college by, again, talking to like disability services or dining residential services, just to find a decision that best fits your needs. Next, I'll highlight the importance. Oh, sorry, still the same slide, Riley. I'll let you know. Thank you. Yeah, I just want to highlight the importance of communicating your needs with those around you. So even though this can be uncomfortable for some people, especially at certain times, it can just be so helpful in the long run to let people know about your needs. So other than disability services, Riley mentioned a little bit that there are sometimes campus dietitians, and people can find that really helpful because they'll have specific recommendations based on your colleges. I will not know all the different options at all the different colleges, so that's where we can kind of group together and they will help you and provide specific recommendations there. And then if you have roommates or housemates, talking to them about your dietary needs can make living with them easier. For eating out, learning or talking to them about your dietary restrictions can make eating out with them easier, so that you can pick a spot that you both or all can eat at and find a safe option. And then when you're out at restaurants, the only way the restaurant staff can accommodate you is by knowing your needs. So again, takeaway here is just communication, and communication is key, which is an advice I wish I heard in my earlier years. Another big tip is to stock up your dorm room with food and snacks. If you've met with me in clinic before, I probably told you this maybe a little too much, But no matter what your meal plan looks like or how big or small your dorm room is, it could be really helpful to have easy on-the-go options. Even like breakfast options can be really helpful. Many of us can find early mornings tricky, so it can be nice to have a backup plan in your dorm room. And when you're working on accommodations, sometimes there's an option to request like a larger fridge with a freezer or a microwave, or to bring in some appliances like toasters or kettles or blenders for smoothies. So you can kind of ask like what is allowed and see what you can bring in. And you can have those options available there. All right, next slide, please. Okay. The next tip kind of relates to the one before. So after you stock up your dorm room with different options, put them in your backpack and have them with you in college. Sometimes you're rushing between classes, and it can be really helpful to have a quick option so that you can make sure you have good energy levels throughout the entire school day. And one other thing I mentioned is once you choose your college, you might be like choosing between different colleges now, but this is like a later step. Once you choose your college, I would recommend getting familiar with the area, exploring a little bit. You can look to see if there's a local grocery store nearby so you can plan where to shop, and you can search for restaurants nearby. If you have celiac disease or you're on a gluten-free diet, you can search for restaurants by looking at Find Me Gluten Free, which is both a website and an app. And then otherwise, you can search on Yelp or Google, and there are options to put in filters for the specific dietary restrictions you have. And then if you want to take it a step further, you can make that list earlier while you have a little bit more time. And then once you get busy, you can look at the list of the restaurants that sounded appealing to you, and you can check it out so that you can go to these restaurants when you're in a rush. What's next? Lastly, just remember to follow up with your care team if you need any support. So we can do telehealth visits together as long as you're in state, to troubleshoot and brainstorm even after you start college. And then if you're out of state, I would recommend finding a care team in your college town that includes a dietitian, or again, checking out and seeing if you have a dietitian on campus that can help you with your nutrition on campus. Okay. The last things I have here are just more resources and more tips about eating in college. The one QR code on the left is for celiac disease. The one on the right is for IBD, so you can take out your cameras and scan them if you're interested. What I can also do though is I can put them in the chat so that we don't have to keep this up for so long. I think it's Anna the next.
Thanks, Farah. Appreciate
Yeah,
it.
of course.
Oh, thank you so much. Well, I'm so excited to be here, and I want to echo Farah's congratulations to all of our seniors or juniors, maybe, but mostly seniors, or folks graduating early who are going to college next year. We're later this, I guess we should say the summer to fall. We're super, super excited, and we're here, and this is just step one. And after tonight, there's so many more conversations we can have offline if you are one of our patients or families that we see at the center. So there's so much to talk about, but mostly just the transition to college is so exciting, and becoming a college student is so exciting. It's so fun. So many new experiences, so much more independence, whether that's you're living at home and going to a local school, or you're flying across the country and going to a school on the East Coast, or anywhere in between. And right, navigating this big transition can cause stress, can lead to stress, and can impact one's health. So your physical health, your mental health, and that could really be a topic sort of all in and of itself, like a separate webinar. But tonight, the main thing that I want to hit home, the main goal that I have is just to emphasize the importance of paying attention and taking care of your physical and your mental health, and how connected those two are, which I'll speak to briefly, and Dr. Jericho will speak to as well. So in terms of your physical health, sort of echoing some of what Farah just said and what's to come, it's really important to stay in close communication with your medical team. So that could be here at Stanford, or locally with whatever GI or healthcare team you put together. And, communicating through my chart or a messaging system that the medical center uses, your appointments, whether that's telehealth or in person, and specifically really communicating new symptoms, new challenges with treatment or your healthcare in general. It's super essential for staying healthy in college. And in turn, staying healthy in college impacts your mental health. And I think this is a really important point to sort of drive home is that, when you have unmanaged symptoms, whether that's celiac symptoms or IBD symptoms, that's burdensome. That's challenging in college. It's challenging at any point in life in any location, but especially when you're away from home or just in a new environment for the first time, it's especially burdensome. And really thinking about if you're not feeling well, then it's probably impacting your academics, or maybe, or your extracurriculars, or if you play sports or whatever hobbies you're doing on campus, your social activities for sure, which if you can't do those fully, that's going to impact your stress and your mental health. So second, being a college student, while it's super fun and new and exciting, and pursuing a higher education is stimulating and wonderful, and being more independent is great, it can also come with stress, right? It's a new part, a new time in your life, and really important to manage stress and to prioritize stress management and your mental health during this time. So you can really just fully engage in college and enjoy college, whether that's your academics and being in the library or socially being out, meeting new friends and everything in between. So thinking about mental health, thinking about stress management, really creating a healthy, a balanced lifestyle can support your mental health significantly. And this may seem very obvious and be very basic to some of you on the teenagers, young adults on the call, on the Zoom tonight, but it is really important to emphasize because these healthy lifestyle behaviors, as sort of simple as they are in theory, when they're really prioritized, they can lead to such positive health outcomes, mental health, physical health outcomes. So things like just getting enough sleep, and it's both the hours of sleep. So, you may have been hearing 8 to 10 for many years, 8-ish, let's say, getting 8-ish hours of sleep, but the regularity of that sleep. So finding sort of similar times, generally speaking, that you're going to bed and waking up each morning. And Riley may speak to some accommodations, but this, for instance, your mornings and classes, you can have priority registration to really make sure you can do things like get enough sleep for being a human and for managing IBD, celiac, mental health. So those are things to keep in mind with just prioritizing things like sleep and sleep hygiene. So in addition to sleep, eating regularly, just what Farah said, eating regular meals, having snacks, exercising, moving your body, just having fun, engaging in fun activities, things that bring you joy, building a network of friends, a social network, having a social outlet, and just finding ways to unwind and relax. Even if you love the library, some time away from the library is a really good thing too for that balance. And all of these behaviors, all of these strategies can help you manage stress so much better and support your mood. Now, there are times where we have more stress and it's hard to manage stress even with those techniques. And we're just experiencing a lot of emotional distress. And that's time where it's really helpful to check out the counseling service at your school or whatever therapy is provided at your school, your college, your university. And these are so great. Like we have CAPS, correct, Riley, is the acronym at Stanford? Yeah, we have CAPS at Stanford, and they are very local. They're on campus. You can get there quickly. They're convenient, and they usually offer short-term mental health support. But if you need or would benefit from longer-term mental health support, these programs, these counseling programs on campus can help you find those sort of longer-term mental health options. And of course, you can always communicate to your medical team. And we encourage that if you're having sort of stress that's unmanaged or having more mental health concerns, and they can help you find mental health services. And if you're seen at Stanford and you know me or you don't know me, you can also see me or talk to our social worker, which to Riley's point, for those of you who know we have not had a social worker, we will be having a wonderful social worker join us at the end of the month. So the future social worker. And we can also help you find local mental health services or see us if it makes sense in terms of what's going on in your life and how much is related to IBD and celiac. So lastly, just really, again, important to emphasize that unmanaged stress or mental health challenges really can, of course, negatively impact our mental health and our emotional well-being and our quality of life, but also it can impact IBD. It can impact celiac. So this might lead to, for some, worsening of symptoms or just GI symptoms in general, or for some, more sort of a trigger of disease activity or a flare. So our brains, our emotions, our GI health, IBD, celiac health, are all intimately connected, and really prioritizing your mental health and physical health in college is going to be part of the pathway to a really wonderful, awesome, successful, and healthy college experience. So with that, I'll pass to Dr. Jericho, who will talk a little bit more about clinical care and supporting your physical health effectively when away at school.
Perfect. Thank you, Dr. Rennan. What a nice mix of different subjects related to college and health and IBD and celiac disease. I know it was briefly mentioned earlier by Riley. My name's Hillary Jericho. I'm a pediatric gastroenterologist. I'm the medical director of the celiac disease program at Stanford. And in addition, I share multiple perspectives that my main priority is caring for celiac disease, but I actually was diagnosed with Crohn's disease when I was 14 years old. And so I've experienced a lot of this as well. It's interesting. I was at college in the, believe it or not, the 90s into the early 2000s. A lot has changed, but I'm happy to answer any questions about my experience back then and how things have changed over time. But from a healthcare professional, things that are really important to keep in mind, both for celiac and IBD, is trying to plan ahead, trying to prepare for what is going to come. I personally think it's always a really good idea to meet with your GI provider prior to leaving for college, making sure everything is set up, ready to go, that you have prescriptions in place. If you're not going to college locally, knowing what that local pharmacy is that you're going to want the prescriptions sent to, making sure you have plenty of refills so you don't run out and suddenly are frantically trying to get a hold of your medications. I do think it's really good. A lot of us in the IBD and celiac world are very comfortable following our patients through college. We know the transition in itself is enough just socially, and having to make that medical transition as well can be just yet another stressor. So not everybody, but many of us extend kind of that pediatric range through college graduation. That being said, having a GI close to your campus if you're going to be farther away, I think is never a bad idea. Ensure you have someone that you can get a hold of quickly, that can see you, help you, examine you. As you've heard about, registering with a disability service if you feel is needed, having the documentation on file. As you've heard already, our social workers, psychologists, the MDs, nurse practitioners, our standard RNs, Lisa and Leah, who many of you have met, are exceptional at helping to generate 504 plans, school accommodation notes. So we're here to help you. And, trying to build your support system. Staying in touch with us, letting us know what's going on, how we can help. We're always here to help you guys. The last couple of points, and then I'll be turning it over to Dr. Benson for the next slide, is again, like I said before, really try to be proactive. I think it was Zach earlier who was saying, as you go to college, you need to be the one to take control and easier said than done. But I think the more you can work towards that autonomy, even as you're finishing up in high school. I know for me, starting to get my own medications, picking them up, understanding how to administer them can be very helpful. We all have these great calendars, electronics now, set up reminders, try to limit situations that are going to be frantic. Keep regular follow-ups, either with your GI that you had before leaving for college, or again, a local GI that you may create a relationship with once you get there. And I think, as you've heard from everyone, especially Dr. Wren, really trying to do things to manage stress and prioritize self-care. Again, always easier said than done. I know for me, and probably most of the people on here know this, I really like riding my bike, and getting an hour of downtime once a day to ride my bike really helps me to unwind, relax, has been amazing for control of my Crohn's disease. Trying to get, 7, 8 hours at least of sleep per night always helps to kind of control things. And then, trying to help eat a really healthy diet. We're all entitled to desserts and that, less than healthy food every once in a while, but trying to keep balance, trying to make healthy food choices is going to keep you healthy on the inside too. So I will turn it over to Dr. Benson in case she has anything else she'd like to add for the last slide, and then turn over to her for this next slide.
And thanks so much, everyone. I don't have all that much that is exciting to add. I guess on my personal standpoint, I think one of the times when I first became interested in IBD, obviously there are many reasons why I'm involved in IBD and IBD care, was when my college roommate was diagnosed with ulcerative colitis while we were in college. And just kind of seeing the impact that that had and linking with my general interest in all of this. Anyhow, I think a common pitfalls, a few things that have come up a lot in my experience have been kind of people being very busy in college and losing touch with their care team. And so it's important to stay connected with whoever is your primary care team, or sometimes there are multiple people involved. So a team closer to school and a team at home, but making sure you are continue to be established so that there's no delays in getting refills of your medication so that people know how you're doing and can address symptoms if they arise. I think it's a great point what's listed here about thinking about who has access to information and what role your parents play in your care. There's a lot of different ways that these things can go. So I've had some patients, and Shira, I hope you forgive me for saying that, but as you are someone who was very independent from a very young age and being like, I got this, I'll do that, I'll update my parents, but this can be me, or some people who really want their parents to still be involved and be helping with a lot of that communication. And it's okay either way, but what's helpful is to have a conversation with your parents and your care team and really articulate roles and who is doing what so that we all know, kind of how to reach out and what to do and who to talk to and make sure that things are taken care of. And to continue some of that independence and communication kind of, and I guess linking to what Zach was saying before, gradually increase that responsibility of saying, you know what, I'm going to take on those tasks that are not particularly rewarding, like scheduling appointments and waiting on hold with insurance and doing some of those things, but kind of gradually getting more and more comfortable with it, and moving that forward. And I guess my most important thing, which is everyone has been saying all along, is just communication and planning ahead really, really, really helps. So just thinking about what needs to happen, how do we contingency plan, where, like where deliver medications are going to be delivered, what's going to happen. Again, my apologies, Shira. What happens when they send the medication to the wrong place? And I'm here and the medication is there, but I need that dose of medicine, right? That problem solving of how to put things together. And we are always happy to work together, but especially if we're planning ahead, what can come up a lot is my medicine is due tomorrow and I don't have insurance auth, or I don't have without a lot of planning, and that can be challenging. The more we plan ahead and we're all working together, the more we can all make things happen and figure it out. And again, a little farther down the road, when there are possibilities of things like studying abroad or traveling around the country, things like that. I've had a lot of patients do a lot of really amazing and exciting things, which I love to hear about. But the more we plan for how do I get infusions in Florence? How do I get injections in Japan? And I've had all of that. How do I go backpacking in Europe with Humira? Like, we can figure it out most of the time, but it takes some thinking through and figuring out. So the more we can plan ahead, the more we can figure out how to make things work as well as possible.
Dr. Vincent, can we go back actually, Riley, to that slide? And I would love to invite, sort of before we open for CUDA and go to scholarships, Shira, sorry, one more back, Riley. Shira, if you have any thoughts in terms of, I know your name was called out a few times there, in terms of common pitfalls and how you handle them, or any sort of like just tips or nuggets of wisdom for our group here tonight, and Zach, you too, and you, Raj, and Mia, anyone here, but maybe starting, Shira, if you have anything, and be wonderful just to hear.
Yeah, sure. So I've definitely had a few mishaps throughout college, but they were all handled eventually. So yeah, as Dr. Benson kind of hinted, like number one, I have always been very, very, very independent, health-wise and otherwise, and my parents are very respectful of that. They're amazing. But surprisingly enough, I did not expect this, but when I started college, I actually wanted to have my parents more involved than when I was at home, especially because I moved across the country. And so I'm in a different time zone. My schedule is very different than it used to be. And so I actually, and also you want to just have fun in college. I don't want to be worrying about making phone calls to insurance while I'm in college with my friends. And so I actually talked to my parents a lot about being able to kind of unload some of those tasks onto them, which was a big adjustment because I also had to learn that like they luckily my mom has Crohn's, so she's quite familiar, but there still was a little bit of learning on their part for like how did they need to communicate for a certain thing to happen or something like that, which can be frustrating, but ultimately it made me feel a lot better because I felt like I had a lot of support in being able to say like, you know, I have a giant test tomorrow. I cannot handle this right now. Like, can you figure out where my package is or like something like that? Um, and then yes, so my freshman year, I was going home for winter break and I was on Stellara at the time. And my package was delayed because there was a snowstorm because I now live in Maine. And I got the email that my package was delivered to our like mail center while I was in the Uber on the way to the airport to fly home for a month. So that was an issue. Luckily, I do try to plan ahead and make sure it's not going to be delivered on a Saturday because nobody works at the mail center on a Saturday, so there's not going to be anybody there to put my meds in the fridge. So I made sure of that. Luckily, they were able to put it in the fridge, and I emailed them and I said, like, I'll be back on campus on this day, and they were happy to hold it there for me. And so when I got home, then our focus turned to how do we get an insurance authorization for another fill as fast as possible, and then I'll use the other one when I get back. Um, but it was definitely a situation where I learned like you have to give a lot of breathing room for everything and you really have to plan ahead. But also at the same time, I learned that every problem is fixable somehow. I also had to go home halfway through a semester because of my IBD, but I was really committed to finishing my classes. And so I, because I had already been open with my professors and with accessible ed, I was really easily able to say, I'm not going to be back. What do I need to do to finish? And I was able to finish all of my classes. And so, again, like every problem is fixable, even if it feels like a catastrophe.
A pitfall I ran into with getting medicine delivered is I don't know why, but I assumed that my apartment getting a giant box with the letters or the word perishable, please refrigerate, they would let me know. Turns out I was wrong and they didn't let me know. And so I had to deal with going down and my Remicade being totally unrefrigerated for over 24 hours and having to deal with that. So just like really getting on that. And if you're in your like if you're in a dorm one year, an apartment another year, it might not be the same. And so it changes year to year.
Thank you, Zach and Shira. That was so helpful. Just such amazing advice and sharing personal experience. And we will maybe keep going and then ask you guys to share, and Yuvraj and Mia too, with the questions and answers, or just sharing openly at that time. Thank you, guys.
And quickly to Zach's point about kind of you, or actually both of your points of like there's pitfalls, there's problems that are going to arise in college. The really good part about college is it's a very safe time to fail. It's one of those where Shira needs to go home to take care of herself. Cool. College, university, very flexible. Work, real life, responsibilities, not very flexible. Flexible to a degree. But this is a wonderful time to kind of have those problems. Forget your medication, deliver it to the wrong place. The main reason is because pediatric GI, a million times amazing. Your pediatricians here are fantastic. And they have that little bit special something that maybe adult care GI doesn't necessarily always have. They do, but not to the same degree of understanding that you're still kind of like floundering and figuring it out. By the time you get to like regular old GI, like I'm in, they expect you to kind of have it together and they don't really give you opportunities to fail as easily. So it's kind of nice. You get to fail safely, is a good way to say it. So you're going to have a fun event. Somebody want to talk about that? Because that's not me.
We will be having a community day. We've been trying to have it annual patient education or kind of times where we can come together and have a morning be celiac focused and the afternoon be IBD focused. And so our annual event is coming up in May in about a month. And love to have participation from all. And if I can speak just a tiny bit to what Riley was just bringing up about transition and adult care, I think just because that's also kind of one of my particular areas of interest and focus. I think absolutely sometimes I think our adult GI colleagues can be very busy and just sometimes again that what the expectations are about care and how things go can vary, but I think we do have wonderful colleagues in the adult GI world who can do a wonderful job in helping to navigate through all of these challenges, again, especially if we communicate and let them know what we need. So I think it's also that and some of our patients have said that, at some point they've even been as happy or happier in our adult colleagues' care because they feel like people are talking directly to them and recognize them more as the individual instead of a part of a family, whereas we in pediatrics are more, family focused as opposed to individual focused. So there are a lot of different things to think about, but it can be still a very wonderful experience in the adult world, especially if you are prepared to advocate for yourself. But scholarships, we put these in. There are a number of different scholarship opportunities for folks with specifically with IBD or with health issues more generally. That Garrett, our prior social worker, put together for us, and some of our team, with especially our nurses, had updated for us in terms of making sure that these are still active and what are the timelines. Some are due fairly soon or recently have just passed, but I think there are a few opportunities to apply for some college scholarships related to your experiences with IBD. So it is a good opportunity.
Did we have, there was a slide with the celiac ones as well. Are those still here?
Maybe Riley, can we go back to this? I know the celiac was up when Dr. Benson was talking, but can we just, in case people want to snap photos or
Oh,
screen,
there they are. Okay. It
Yeah.
went through very quickly.
we
Yeah,
can
so
give-
these are some of the celiac scholarships that are out there too for anyone on the call with celiac disease.
and please feel free to take pictures, screenshot. These are
Mhm.
wonderful, and we'll have access afterwards as well.
Yeah, all of the I'll send out an email when they're available on the webinars that go out, both to the IBD and celiac email list servers. But it'll have a direct link to this video. It typically takes a few weeks to get it uploaded onto YouTube, but then you can always go back and reference these later.
And then I know it's 6 o'clock, but I think we're happy to hear any questions or comments or additional thoughts about people's experiences with, heading to college.
Yeah, so I think before we jump into that, let's pause the recording so everybody can ask questions a little more openly.